Welcome to The Simple Show and our final talk about dementia, and this time we're going to have a deep dive with Dr. Heinz Luescher, where we're going to go into the nuts and bolts of what he does in the clinic here at WiseMed when he treats dementia patients in phase 1 and phase 2. So please dive in. What do you do really?
So treatment is, on one hand it's easy, on the other hand it's complicated because it takes several different products. There is not one or two capsules and you get better. See? For other diseases like an infection or so, there are give 2 pills and that's it. But here we have a combination of a bundle of products that are important. So again, omega-3 fatty acids are so crucial, but there it's important that you take them years before. See, with omega-3 fatty acids, when you start with them, when the dementia is already here, then the effect is not that obvious. So we need 2 tablespoons of fish oil or oil of algae. See? Doesn't matter what. We need a lot of DHA for the brain, so algae are better, but fish oil is also okay. So 2 tablespoons. Then vitamin D, I suggest at least 5,000 international units. Then we need coenzyme Q10. This Q10 is important because the cells can produce energy directly from Q10. So if the metabolism is weak and we are lacking lots of other micronutrients, we can give the body Q10 and NADH. See, both are important and both are really only one more step, see, in the metabolism, and we have enough energy.
And how much?
So usually a capsule contains 50 milligrams, so the minimum here is 3 a day. 150 milligrams. Would be better go double, 300. Sometimes it's a question of the financial possibilities, but that's 3 to 6 capsules a day. NADH, 1 capsule, it's like a candy, so you lick it in the mouth and let it dissolve. You don't swallow it. Here at least 2. Then we have antioxidants. Here I suggest grapeseed extract, vitamin C, at least 1,000 milligrams, and you can go up to 3,000 or 4,000. It's no problem. Grapeseed extract, 400 to 600 milligrams a day. It usually says on the label of the product, it tells you how much is in 1 capsule. So usually it's 100 to 150 milligrams in 1 capsule.
And why grapeseed extract?
This is anti-inflammatory in the brain, because inflammation, silent inflammation, is always there in dement patients. This is it has to do with the origin of the disease. So we need to decrease inflammation, and that's why I prescribe a lot of antioxidants. And then there is a substance called phosphatidylserine. This is a little bit more tricky to get. You have to check in the internet and where you get it. Here it's important to take 2 to 3 capsules a day. And then something really good is coconut. Coconut fat. You buy extra virgin coconut fat, organic, and take a really good tablespoonful every day.
Okay, what else?
Any neurological diseases are connected to the guts. See? So if I want to do a proper and really inclusive treatment, then I have to treat the guts as well. So I suggest a probiotic. There are usually it says on the label. It depends on the product, if it's liquid or capsules or whatever. So take a good probiotic with at least 10 or more different bacteria. And we have a product called NeoVital that improves the resorption of the capacity of the mucosa in the gut. So it's important that all this stuff we take, it's getting into the body, and for that we need a good functioning intestine.
Okay, so that's the micronutrients side of things.
Yes.
What else do you do in the clinic here? Other integrative medicine treatments?
We have a therapy called IHHT. This stands for intermittent hyperoxy therapy, and what it does is it increases the number of mitochondria in the brain cells, actually in the entire body, but we want it in the brain cells. And the more mitochondria we have, the more energy is coming back. But these patients have to come at least 50 times, and every time it's an hour. But it's really effective. And the last and maybe best solution is infusions. We can some of these products are available in infusions. So the product we are using is called phosphatidylcholine.
Okay, so with infusions and with IHHT, those are some treatments that you can
of course, the best would be all three together, but that means you show up here every week for a year.
Okay. Well, so that was our look into the treatment, nuts and bolts of dementia here at Wise Medicine, and thanks for watching. We'll see each other again. Bye-bye.